Yeah, so I was starting platelet-rich plasma treatment for male pattern baldness, also called as androgenetic alopecia. So this is a very good treatment for hair regrowth. So in this treatment, first we counsel the client about the treatment, about the procedure. Now, and we take venous blood about 10 to 20 milliliter of blood, and then first this is the blood which we have taken. And now we will centrifuge it after mixing anticoagulant. So now we are doing the centrifugation process. Yeah, so now I am starting platelet-rich plasma treatment. We have already centrifuged 10 to 20 milliliter of blood. In this case, we have centrifuged 20 milliliter of blood. Now I am doing this platelet-rich plasma treatment for androgenetic alopecia or hair loss treatment, which is basically genetic or sometimes. So now I am cleaning the scalp with betadine. Betadine is good for a scalp. One should not use a spirit because it can cause irritation. Now I am cleaning his scalp with betadine. After you can apply local anesthesia cream or local spray. We have already applied. Now I am doing the treatment. So now I am cleaning his scalp so that we can do this is invasive procedure. And patient should be healthy. Patient should not take Disprin 1 or 2 days back because it can cause unnecessary bleeding. Now you can see here. You can see this thing. See, this is a stand. So you can see there are 3 fractions in it. One is platelet, this is RBCs, this is platelet poor plasma, and in between is the platelet-rich plasma. That is a Buffy code. I can see more tubes. You can see more clearly. This is platelet poor plasma. This is red blood cells, and this is platelet-rich plasma, which is in between. So we have to inject the platelet-rich plasma and platelet-poor plasma also, because platelet-poor plasma also has platelets in it. So we inject platelet-poor plasma also. So there are two methodologies to inject platelet-poor plasma. We use one. This is a 1 milliliter syringe with small needles in 31 gauge needles in it. You can easily use this. First you take your test tube and you take that platelet-rich plasma. Just I am taking platelet-rich plasma from the buffy coat layer, which is in between the platelet-poor plasma and platelet and red blood cells. First I am taking this, and now I will inject platelet-rich plasma. So these syringes should be sterile. You can use auto pipette also, but as I think it's difficult to use auto pipette, my methodology is to use 1 milliliter syringe to take the platelet-rich plasma from a buffy coat. So I am taking this platelet-rich plasma. So this is basically platelet-rich plasma overall. Now I am injecting the platelet-rich plasma in the scalp. In the scalp, you should have gauze pieces. Now I am injecting the platelet-rich plasma. Take the close view. This is the platelet-rich plasma I am injecting very deep inside the skin, below the dermis. So many people ask, where do you inject platelet-rich plasma? So I inject below the dermis. The needle should be like perpendicular. Needle should be perpendicular, and it should go deep to inject the platelet-rich plasma. Otherwise results will not come. You will not see the results if you not inject properly. So now I am again injecting platelet-rich plasma. Platelet-rich plasma is again I am taking the middle layer or between the platelet-poor plasma and RBCs. You can see the yellow layer is platelet-poor plasma. It has platelets, but it's a small quantity. So I am using the buffy coat layer, that is platelet-rich plasma. Platelet-rich plasma has platelet-derived growth factors in it, and these growth factors help in stimulating the dormant hair follicles. Not only platelet, there are so many growth factors are there, like platelet-derived growth factors, which help in growing the dormant hair follicles. See now I am using this. You can see it. So we are using it and injecting it at several places over the scalp, which you see it should be injected. But platelet-rich plasma, in my experience, is useful for youngsters. So now I am injecting again. Now I am taking it again. See, I am taking it again. This is platelet-rich plasma I am taking. Now I will inject this platelet-rich plasma into the scalp of the patient. See, this is 90-degree angle. You have to inject the PRP. Now this is platelet-poor plasma. This is the platelet-poor plasma, which is yellow in color. Yellow in color is platelet-poor plasma, and I am using this platelet-poor plasma also. So many people discard it, but I use it because it has platelet-poor plasma. Although it has density less platelets, but still one should use it. And now I am using it with the help of derma roller. So this is a micro needling machine. This is a micro needling machine which I use it for him for in the last session also, this session also. we keep it in the formalin chamber to sterilize it, and now I'm using it for his scalp. So this is microderma roller, also called as micro needling machine. This is a very breakthrough in the hair science, this micro needling machine, because this increases the hair circulation, hair microcirculation over the scalp, thereby increases the hair regrowth. So it's a very good technology to use it. So you will get the pinpoint bleeding. You see that you can take this is a pinpoint bleeding, you can see, and now you can you can use this platelet poor plasma over this. So now you can pour it over the plate. Now I am taking more platelet poor plasma. You can mix the platelet poor plasma and platelet-rich plasma also to have a good result. So now I am injecting. I am using micro needling machine again. I am rolling over his scalp. I am rolling over his scalp, and now I am pouring this platelet poor plasma along with some platelet-rich plasma. Sometimes it is difficult to distinguish. There is a very thin layer. So and now you rub it over the scalp. It's a slightly long process, but you have to use more and more of your platelet poor plasma. You have to. I'm again using this roller, and this is over this area. This area you can see very thin area of the thin density of hair. So now you are using the derma roller. Client may have sometimes pain. It's a slightly painful procedure, not very painless. So you can use anesthesia. Now you can rub it. Plasma over this. Now I am using it again for other areas of the scalp, like this. Okay. Now we pour platelet poor plasma over it. Basically platelets, these platelets degranulates. Basically granules come out of the platelets, and these activates the dormant hair follicles. So this is the process, or this is the way how platelet-rich plasma works. This is a very good treatment in male pattern baldness, female pattern baldness, female hair loss. A wonderful result. And again using it over his other areas. Where the density of the hair is less, we are using it to stimulate the hair follicles, dormant hair follicles. We have coined a term called MEGFL in our clinic. In Magical Morphers, we have coined the term MEGFL. In the MEGFL, we do mesotherapy plus growth factors through platelet-rich plasma and laser treatment. So now you are watching platelet-rich plasma treatment. can see. Now again I am pouring platelet-poor plasma and I'm rolling over his scalp. I am pouring platelet-poor plasma over his scalp. So this is called as platelet-rich plasma treatment. Now the patient has to keep, the patient doesn't have to wash this for the next 6 to 8 hours. He has to keep it because it will absorb. Platelet-rich plasma, platelet-poor plasma will be absorbed by the scalp and it will help in the absorption. So now he has, I will give him a cap and he will wear that small sterile cap and now he can go out. So this is and we will repeat this session after 1 month. So this way we will do 4 to 5 sessions of the treatment. He will see the results after 2 weeks, 3 weeks. He will see the results also, and it's a wonderful treatment. So this is called a platelet-rich plasma. Thank you for watching this video. Thank you.